Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And today we're talking about liver disease and an organization with a local chapter looking to help people who suffer from it and their families as well. It is the American Liver Foundation's Greater New York Division. Our guest today is Dr. Bernstein, Chief of Hepatology and Director of the Sandra Atlas Bass Center for Liver Disease at Northwell Health, and a member of the Foundation's Medical Advisory Committee. Dr. Bernstein, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Jeanine, thank you very much for having me.
So first of all, how are you doing personally during this COVID pandemic?
So I have to say, and I thank you for asking, we're really doing well. It's been a tough ride. I think myself and all my staff have worked very hard, but it hasn't interfered at all with the care that we've been giving the patients. We've been very lucky here at Northwell to have a truly safe environment for the staff and for the patients. And, we look forward to this hopefully coming to an end so we can get fully back to business.
Yeah.
But there have been some positives, here. The telehealth that have come in, our ability to see the patients at home. They not having to travel long distances to get here for things that we've now learned to be handled at home, and everyone's got a little more time with their families, which I think is nice.
So tell us about the American Liver Foundation and its mission.
So the American Liver Foundation is a national organization that has divisions across the country. And so since we're in New York, this is the Greater New York Division of the American Liver Foundation. For people with liver disease, it's the country's largest advocacy group. And it's really a foundation that focuses on patients and their education, getting information out to the population so they understand more about liver disease, providing educational services for patients, but also for providers, engaging providers and patients and their families in forums that are, I would say, low pressure learning where people really get, to know each other, and also providing, different support services for families, patients, and the like.
So for those who do not know, tell us about what does the liver do and why is it so important to us?
The liver has multiple functions. I think first and foremost, it's important to understand that it's the largest organ in the body. The skin is the largest organ in general, and there's only one of them. Like you have two kidneys or two lungs, you only have one liver. The liver really serves several large purposes. The first thing is all blood flow in the body flows through the liver. So the liver functions to remove toxins and potentially dangerous chemicals from the bloodstream. So it's a filter. Second is most medications actually also go through the liver where they're metabolized, broken down. Sometimes a medication can be a prodrug, meaning it needs to be broken down in order to work in the body. Other times, you want to make sure that you don't have too much medicine around, and so the liver will then break down the medication so we don't get toxicity. So metabolizing medications are critically important. And then third is that it functions as a factory, if you will. It manufactures things. So for example, it manufactures the the clotting factors that we use in our body so that when we cut ourselves, we stop bleeding. It manufactures bile, and bile is used to carry away the waste in the intestine, but also to break down fats and help us digest. It makes lots of different proteins that we use to digest foods. And it makes and stores cholesterol, which we all know about, and it helps regulate the amount of glucose in the body. So it has a lot of diverse functions that help keep our body really running healthily, if you will.
Can we survive without one?
No, we probably wouldn't survive more than a few minutes without one. So you actually have to take good care of the one that you have in the hopes that it stays going. The interesting thing about a liver is that actually if you treat a liver well in the course of your life, the liver doesn't age. And we know that because you can take a liver from someone in their 70s, transplant it into a child, and that child can grow to be in their 70s, 80s, 90s, and not have a problem related to that liver, getting old. So it's somewhat unique within the body.
So it actually regenerates itself.
It's continually regenerating itself. Yes, It's one of the few organs, along with the skin, that has ability to repair itself. Absolutely.
So when the liver is diseased, how is it in terms of recovering the liver from a disease? Is it an easy recovery because it has this characteristic of regenerating itself?
So, that's a great question. And the answer is dependent upon the extent of the injury to the liver. If someone has an acute toxicity, let's say it's related to a medication, Tylenol, for example, that people know about, or other antibiotics, the vast majority of people, in fact, 99%, will get better. The liver will regenerate itself from that acute injury and get back to its baseline such that there'll be no long-term sequela from that acute injury. Even chronic injury, from various diseases that can cause chronic liver disease, as the liver becomes more fibrotic and you begin to lose the function of the liver cells, which are called hepatocytes, you have to lose more than 90% of them, if you will, before you start seeing liver dysfunction. So the liver is pretty darn resilient. But once you sort of cross that threshold from working to non-working based upon chronic liver disease, in the absence of some sort of intervention, it won't get better. And I say that because that's very exciting for what I've seen, and I've been doing this now for more than 25 years. There are medications for certain diseases which will even reverse cirrhosis and liver dysfunction. And so it's really an exciting time for those who care for patients with liver disease, as we see the epidemic of liver disease, unfortunately, spreading across this country.
So what are some of the common diseases associated with the liver? You mentioned cirrhosis. Are there others?
Yeah. So I think so that's another great question.
Mm-hmm.
So I think it's important for everyone to understand that cirrhosis isn't a disease. Cirrhosis is a consequence of any type of chronic liver disease. And so the real question, I think, is what are the common causes of chronic liver disease? And for that, we have to talk about something like fatty liver, right? Which is probably the most common reason, or is the most common reason, why people in the United States develop cirrhosis. That comes from being overweight, and we know that that's a problem in the United States. And it comes from having diabetes. So fatty liver disease, number one. Another really common cause of chronic liver disease in the United States is alcohol use. And people always ask the question, how much alcohol? Well, everyone is different. In a thin woman, you need far less alcohol over time than in a overweight man to develop advanced liver disease, from alcohol. So alcohol is another common cause. There are viral hepatitis infections that can cause this. Most commonly hepatitis B or hepatitis C. There can be hereditary diseases, that are seen. Things such as hemochromatosis or Wilson's disease or alpha-1 antitrypsin deficiency. And then there's another whole group of autoimmune conditions that can lead to the development of chronic liver disease. All of these conditions can lead to cirrhosis. And once someone develops cirrhosis, doesn't matter really what the cause is, then it becomes a very serious risk for patients, because that's when patients with liver disease have risks of the dire consequences of cirrhosis.
So in this case, when there is cirrhosis, is it that we're seeing transplantation at that point?
Sure, livers can be transplanted. So no matter what the disease is, when someone reaches the point of cirrhosis and then develops decompensation, they become potential candidates for liver transplantation. We base that on actually a simple score, which is called the MELD, M-E-L-D score, which is a mathematical formula of 3 different blood tests that we get. A measure of clotting called the INR, a measure of kidney function called the creatinine, and a measure of liver health, if you will, based upon the bilirubin. We don't do as many transplants as we'd like. The lists at our institution and others are very long, but we're limited by the donors. There are about 8,000 cases of liver transplant done a year. We could do many more if we had donors. Remember, there's no artificial liver. So in order for someone to get a transplant, one of 2 things has to happen. Somebody has to die who's healthy, and that liver then can be used to be put into someone else. Or there's something called living-related donation. Living-related donation is someone who has the same blood type and the same approximate size of the liver can give half of their liver to a patient. And interestingly enough, if you take half the liver and give it to the patient who needs it, within about a month or 2, both halves will grow back to normal size.
Very interesting. You're listening to Your Family's Health on the voice of NASA Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning about liver disease and the Liver Foundation Greater New York Division with our guest, Dr. David Bernstein, Chief of Hepatology and Director of Sandra Atlas Bass Center for Liver Disease at Northwell Health, and a member of the Foundation's Medical Advisory Committee. So, Dr. Bernstein, we're talking about the foundation. What is the mission of the foundation, and how does the mission relate to treating the patient?
So, great question. So the American Liver Foundation's goals are to increase awareness regarding liver disease. That hopefully will help patients self-identify if they're at risk for liver disease, and then come in to ask their healthcare provider about their liver, and if needed, then hopefully get appropriate treatment. The American Liver Foundation also educates regarding specific treatments which are available, for different liver diseases. So, for example, for fatty liver disease, the treatments currently are diet, exercise, weight loss programs. For hepatitis B, there are oral medications which suppress the disease. For hepatitis C, there are oral medications that cure the disease. For some of the autoimmune conditions, there are various medications that we can use. And in the community, there are some grave misunderstandings regarding liver disease. Most common is that liver disease is all from alcohol, which isn't true. Second is that once you develop cirrhosis, that's the end, and that's also not true. Most people actually die with cirrhosis than of it, and that there aren't treatments for liver disease. So the American Liver Foundation is really out there on the front lines trying to educate so that that history of misinformation can hopefully be overturned so that people understand, and also allow the patients with liver disease to be more open about talking about it and getting over that stigma that we're seeing. And I think they're doing a pretty good job in that. It's an uphill battle, but they're certainly making some headroads, especially in our area.
So what could be some symptoms, early symptoms, that we can probably see in someone that has liver disease?
So that's the toughie, since almost all liver diseases, unless they're acute, don't have any symptoms whatsoever until it's more advanced. So what are the common presenting symptoms early? People can just feel more tired, than they had before. People may notice, or actually their family or friends may notice, some yellowing in the eyes, which is called jaundice. People may get some vague abdominal pain, although quite frankly, it's one of the less common causes of abdominal pain. People can develop easy bruising. What are easy bruising? You hit your arm more than the same as someone else, and then all of a sudden you have that black and blue mark, or ecchymotic area. People can develop unexplained itching. So these are things that happen early on, but most of the time people come in undiagnosed when a catastrophe happens. What are those catastrophes? They get encephalopathic or are confused, and someone brings them in. They start vomiting up blood, which is a sign that distended veins in the esophagus called varices may have ruptured and have bled. They all of a sudden have distension of their abdomen because their abdomen can fill with fluid called ascites, and they notice an increase in their pant size. And last, but certainly not least, they can present with pain later on, and that can be imaged, and they're at risk of developing liver cancer. But the key here is to understand the potential risk factors of liver disease and ask early. And when you go to your doctor and get that annual physical examination, they are checking liver enzymes, at least yearly. Now, many diseases can have, liver diseases can have normal liver enzymes, but it's really the best screening type test that we have. If someone has a history of tattoos, for example, or practicing unsafe sex, or using cocaine or IV drugs now or in the past, those are risk factors for viral hepatitis. So you would be checked. So it's important to have those honest discussions with your healthcare provider and hope that your healthcare provider then will follow up to try to catch things early, because almost all liver diseases, if we catch early, we can intervene and very likely prevent disease progression from occurring and prevent those dire consequences that we spoke of earlier.
So who are more predisposed to liver disease, men or women?
So overall, it's about the same, because the most common reason for liver disease in the United States is non-alcoholic fatty liver disease. And so that's a pretty equal split. But there are certain conditions where women are more likely to get liver disease than others. And what are those conditions? Those are the autoimmune diseases, something like autoimmune hepatitis or primary biliary cholangitis. Even alcohol use is very common amongst women, but yet undiagnosed most of the time. And it takes less alcohol in a woman than a man to develop, chronic liver disease. For the most part, because women tend to have a lower body mass index. And the more alcohol you drink with a lower BMI, the more likely you are to develop liver damage.
What are some of the activities to raise awareness that the American Liver Foundation engage with in the community?
So the American Liver Foundation does a whole cadre of events. They do a lot of local events around the community. Now, of course, this is in the pre-COVID era, so things are adapting.
Yeah.
But they do a lot of these smaller events where patients and or their families or people in the general community are invited to come listen and learn, because that's really a highly effective way of getting information out there. They do something called a Long Island Rebirth Day, which is an educational program that's put on specifically for patients and families of those who've had liver transplant to celebrate, another year of doing well after that transplantation. They do something called the Liver Life Walks, where they hold family-friendly walks in various parts of our area, in Long Island, in New York City, and in New Jersey, to really raise awareness. Everyone's invited. You don't have to have liver disease or be a family member. The more, the merrier. Every year they have an annual honors gala, which brings together really the key physician leaders, the key other professionals and business leaders in the communities to raise awareness and, quite frankly, to raise money to be able to put on all these different events. And then they have smaller events, which have been very successful, again, all based upon raising awareness. Things like marathons, half and full marathons, yoga events, all sorts of things in the hopes of raising awareness. Because it really is, by the numbers, 1 in 3 Americans have chronic liver disease. That's over 100 million people. And most don't know it.
Has this number increased over the years because of the rise of obesity, or what would you say the rise is due to?
So the rise in, you hit the nail on the head. So the rise in chronic liver disease is directly related to the rise in the incidence of diabetes and obesity. And so 25 years ago, 30 years ago, when I first started doing this, fatty liver as a diagnosis really didn't exist. Mm-hmm. And now it affects over 100 million people in the United States, directly related to the obesity problem we have and the rise in diabetes. And we see it starting in young people. We see lots of overweight young folks. We see lots of young people in our area developing diabetes. And all of this has led to a significant rise in the number of people with fatty liver disease. And fatty liver disease accounts for the vast majority of chronic liver diseases in the United States. And again, that's the one condition that we don't have good treatments for. Everyone wants a magic pill, which does not yet exist. And the treatments are really recognizing the condition, an appropriate diet, exercise, and weight loss. Fatty liver disease usually presents 10 years before someone gets diabetes. So if you diagnose fatty liver disease, you can intervene and hopefully prevent or delay that person from getting diabetes. The consequences of diabetes actually are even worse than having liver disease.
How can people get involved with the Greater New York Division of the American Liver Foundation?
It's very easy. The American Liver Foundation is always looking for people to help. They can contact them. Easiest way is to go to their website, www.liverfoundation.org, find out more information about what's happening locally and nationally, and volunteer to become involved if they'd like. It's a very welcoming organization, and I'm on the medical advisory board. I'm not employed by them. I'm a Northwell Health employee. But we work very closely with them, as do all of the other major health systems in our area work very closely with them.
So if one of our listeners are wanting to get in contact with you, what is the best way to get in contact with you or the American Liver Foundation?
With the American Liver Foundation, the best way to contact is www.liverfoundation.org. If you want to get in contact with me for things related to the American Liver Foundation, it's really the same email, and their staff will facilitate that.
So if you had to leave us with anything, Dr. Bernstein, what would you leave us with relevant to liver disease and the awareness?
So I would say key points, if you will. Liver disease is extraordinarily common, affecting 1 in 3 people in the United States. Most people who have liver disease have no symptoms and don't know it. Most people with liver disease never get to the point that they develop cirrhosis or need a transplant. Cirrhosis isn't a death sentence and is treatable, and cirrhosis isn't a disease itself. It's a consequence. If you think you have any potential risk factors for liver disease, you should go to your healthcare provider and discuss that. And your healthcare provider will follow up. But it's very important not to ignore something. What you do today can help save you and have better health 1 or 2 decades down the road.
Well, thank you so much for that and being here with us today, Dr. David Bernstein from the American Liver Foundation's Greater New York Division. We hope you stay safe and continue to do great work for Long Island and its surrounding communities.
Thank you very much.
This is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College, and I thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the Nursing Department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.